Good afternoon. I'd like to thank EUROSPINE for this opportunity to present the SupportBack trial, and we have no declarations. Whatever our profession, we all need to engage in helping patients to self-manage. We know the misery of back pain. We know that services have insufficient capacity to meet demand, and we need to find ways to work smarter, not harder. Why? Well, firstly, because our evidence-based guidelines tell us so. Here's an example from the United Kingdom, which shows that self-management is recommended at all stages of the pathway. And along with exercise, self-management is considered the gold standard of non-invasive back pain management. So one way is to use digital interventions, and there's a lot of research in the field now with more than 40 protocols registered. And we've trialed a web-based intervention called SupportBack with 825 patients in multiple centres in the United Kingdom, focusing on behaviour change with and without telephone support, and we published the protocol. We developed the content of the package with 22 patients, and it provides reassurance, advice, and support for a 6-week programme. The patients register and they get weekly emails, and they start off with a choice of either gentle back pain exercises or a walking program. And then each week they have options for modules on sleep, mood, work, medication, flare-ups, and active living. So we did a feasibility study, and what we learned from that was the patients really benefited from having information released in weekly intervals rather than being given everything at once. So the SupportBack trial, the aim was to determine the clinical and cost effectiveness of unsupported and supported internet intervention for people with low back pain. To date, it's the largest trial of its kind in the United Kingdom, and it was particularly impressive. It nearly killed us all as we were data collecting during COVID. You'll see that it's a pragmatic, multi-centered, 3-arm trial where we had usual care plus the internet intervention, and the third arm was usual care, the intervention, and 3 telephone calls from a senior physiotherapist over the 6 weeks. We recruited 825 adults from 179 GP practices. Our primary outcome was low back pain-related disability using the Roland-Morris score at 12 months. And you can see there the secondary outcomes we listed. We set the bar high with a really tough analysis. We set alpha at 0.025 because we wanted to compare both interventions with usual care. And it was a repeated measures design over 12 months and an intention to treat analysis. So what happened? Well, there was a small reduction in the Roland-Morris in both the intervention and the supported intervention, and the green line is the usual care alone. What you'll see there is the blue line, which is the intervention plus the telephone calls. The improvement happened sooner compared to the red line, which was the intervention alone. And there were no serious side effects. What we found was the patients in the group that also had the telephone calls accessed the website more often and got their improvements sooner. But the proportion of people who had a 30% reduction in the Roland-Morris at 12 months was higher in both the intervention and the supported intervention group compared to usual care. In terms of the economic analysis, both interventions were cost-effective with the QALYs of £20,000, although obviously the intervention alone dominated. This was a huge collaboration with multiple universities, and we have to thank the National Institute for Health Research for funding this trial. We published it in the Lancet Rheumatology at the end of May, and our conclusion is that highly quality interventions that are evidence-based, goal-orientated, and co-designed with service users can be a cost-effective adjunct in primary care, but they don't necessarily need support from health professionals. So my take-home challenge to all of you is wherever you work, find out what resources are available for your patients and promote their use for self-management. And don't forget that EUROSPINE Patient Line has a lot to offer there as well. And hopefully that will leave your spine services less overwhelmed and you able to focus on the patients who need more of your time and skill. Thank you.